Are you a cesarean section patient? Have you ever wondered how long it takes for the incision after a C-section to heal? During the recovery period, what nursing details should we pay attention to? How can we effectively prevent wound infection to avoid unnecessary pain? Do you know some tips that can help reduce pain and make recovery easier? Most importantly, how can we promote healing through diet and rest? Hello everyone, welcome back to my channel. I'm Sophia. Today, we are going to discuss a very important topic, wound care after cesarean section. 1. Why is post-operative wound care after cesarean section so important? First, let's explore why caring for the wound after a cesarean section is so important. A C-section is a surgery involving the abdomen, where doctors make an incision of about 10 to 15 centimeters to carefully extract the baby. Although the procedure is handled delicately by doctors, this incision still causes some damage and discomfort to your body. Did you know that proper wound care after a C-section not only affects the healing speed, but also directly relates to your overall health and emotional state? Therefore, understanding and implementing the correct care steps are crucial for your smooth recovery. 2. Healing time of C-section wounds. So, how long does it take for a C-section wound to heal? Generally, most C-section wounds will heal significantly within 6 weeks, but complete recovery may take 3 months or even longer. During this recovery period, the body needs enough time and nutrients to repair the tissues. So, what specific care measures should we take during this recovery period? Let's gradually unveil these key care steps. 3. How to keep the C-section wound dry and clean. Do you know what the biggest threat to a surgical wound is? Infection. Infection not only delays wound healing, but can also lead to further surgeries or complications. Keeping the wound clean and dry is crucial. So, how can we achieve both? 1. Clean the wound. Gently wipe the wound with sterile saline or a cleaning solution recommended by your doctor, avoiding direct contact with bath water. The oil and sweat around the wound can easily accumulate, especially in hot weather, so maintaining cleanliness is particularly important. To keep it dry, after each cleaning, be sure to gently pat the wound dry with a clean towel without rubbing it. If you feel the area around the wound is moist, you can use a hairdryer on the cool setting to help dry it quickly. Imagine the refreshing feeling of a dry wound. It's truly comforting. 3. Avoid excess moisture. Try to avoid exposing the wound to overly moist environments and opt for breathable, loose-fitting clothing to allow air circulation and reduce sweat accumulation. Think about how much more comfortable you would feel in relaxed clothing during daily activities. 4. How to prevent infection in C-section wounds. Even with careful nursing, a wound can still get infected due to minor details. The key to preventing infection is to observe regularly and take appropriate measures. How should we do this? 1. Regularly check the wound. Examine the wound daily for any signs of redness, swelling, heat, discharge, or other abnormalities. If these symptoms appear, it may indicate an infection, and you need to contact your doctor immediately. Did you know that early detection of issues can significantly reduce the risk of complications? To avoid overexertion, while moderate activity helps promote blood circulation, you should avoid vigorous exercise or lifting heavy objects after a C-section, as this may pull at the wound, leading to tearing or bleeding. Did you know that the body is more capable of self-repair when resting? 3. Change dressings regularly. If your doctor advises the use of wound dressings, Be sure to change them on time and follow your doctor's guidance to ensure the wound is in good condition. Follow medication instructions. If your doctor prescribes antibiotics or other medications, be sure to take them on time, as this can effectively prevent infections. Think about how following your doctor's instructions gives you peace of mind. 5. How to reduce pain after cesarean section. In the days following a cesarean section, many mothers experience pain at the incision site. This is actually a natural part of the healing process. Are there any methods to alleviate this discomfort? 1. Use pain relievers appropriately. After childbirth, doctors usually prescribe some painkillers to help mothers relieve post-operative pain. Following the doctor's instructions when taking these medications can effectively reduce pain and help you get through the recovery period more easily. Do you feel that appropriate medication can make your recovery smoother? 2. Use supportive items. A postpartum abdominal binder can effectively support the abdomen, reducing pressure around the incision, which helps to alleviate pain. However, make sure to choose the right size and use it according to your doctor's advice. 3. Pay attention to posture. When getting up, sitting down, or holding the baby, try to use correct posture to avoid putting too much pressure on the incision. For example, when getting up, roll onto your side and use your arm to push yourself up, minimizing the strain on your abdomen. Are you aware that good posture can make you feel more comfortable in daily life? 6. How to care for perineal injuries. Some mothers may experience perineal cuts or tears, and caring for these wounds is similar to caring for a cesarean incision but requires special attention. 1. Maintain cleanliness. Use warm water to wash the perineal area and keep it dry. You can use a specialized perineal wash solution to help prevent infection. 2. Change sanitary pads frequently. During the postpartum bleeding period, change sanitary pads regularly to prevent bacterial growth. 3. Relieve pain. You can use cold packs or sitz baths to relieve pain and swelling and help the wound heal. Imagine the relaxing feeling that a comfortable sitz bath can bring. It's truly delightful. 7. When should you seek medical help? During the recovery process, certain signs indicate that you may need to contact a doctor immediately. For example, persistent redness, swelling, pus, or foul smell from the wound, prolonged fever or extreme fatigue, severe abdominal pain or swelling near the incision. If you encounter these issues, do not attempt to handle them on your own. Seeking medical attention is crucial. Did you know that timely medical intervention can effectively prevent more serious problems from occurring? In addition to external care, internal nutrition and rest also significantly impact the healing speed of the wound. Do you know which foods can promote wound healing? 1. High-protein foods. Foods like eggs, fish, and legumes are high in protein and can accelerate cell repair and regeneration, helping wounds heal faster. 2. Foods rich in vitamin C. Foods such as citrus fruits, strawberries, and spinach are rich in vitamin C, which helps promote collagen production and accelerate wound healing. Imagine that simple fruits can help your body recover better. It's truly amazing. 3. Stay hydrated. Staying hydrated helps maintain normal cellular functions, speeds up metabolism, aids in detoxifying the body, and promotes healing. Are you aware that staying hydrated can make your recovery process smoother? In summary, caring for a cesarean section wound is not complicated, but it requires attention and patience. By following proper cleaning procedures, conducting regular checks, preventing infections, and ensuring adequate rest and nutrition, you can significantly reduce the risk of infection and speed up recovery. Remember, taking care of yourself is not only essential for your swift recovery, but also for better caring for your baby. I hope today's content provides you with valuable information to help you navigate the recovery period after a cesarean section smoothly. Don't forget to subscribe to my channel so we can continue to explore more parenting and postpartum care knowledge together. Thank you for watching, and see you next time.